Hello, I'm Ashka Sheth, and I'm going to discuss a few articles on the effectiveness of neural mobilization to treat chronic low back pain. The term low back pain is characterized mainly by pain in the lumbar spine region, a condition that affects individuals of both sexes and it reduces their ability to do activities of daily living. The economic effect of lumbar spine disorders is also very great. Physical therapy interventions to treat low back pain include therapeutic exercise, functional training, manual therapy techniques like mobilization and manipulation, and various electrotherapeutic modalities. One of the available treatment is neural mobilization, which is characterized by a set of techniques that aim to impose greater tension in the peripheral nervous system through certain postures, through slow and rhythmic movements, and are applied to peripheral nerves and spinal cord, and it improves nerve impulse conduction. Neural mobilization has also demonstrated excellent prognosis in patients with neuropathic pain, and it also presents other advantages like it has low operational cost and has no side effects. The first article that we're going to discuss is effectiveness of slump neural mobilization technique for management of chronic radicular low back pain by Mudassar Ali. The objective of this study was to determine the effectiveness of slump neural mobilization technique in physical management of chronic radicular low back pain. This was a randomized control trial and it had 40 patients aged between 20 to 60 years and who tested positive for slump test. The subjects were excluded if they had a spinal fracture, osteoporosis, diminished lower extremity reflexes, signs of upper motor neuron lesions, or had a history of spinal surgery. Before the participants were divided into two groups, they were asked to complete several self reported outcome measures like the 4 point numeric pain rating scale. And their perceived disability was assessed by using the modified Oswestry Disability Questionnaire. All the participants were divided into two groups. Group A received the slump slider neural mobilization, stabilization exercise, and shortwave diathermy. Group B received stabilization exercise and shortwave diathermy only. The outcome measures of numeric pain rating scale and modified Oswestry disability questionnaire were taken again after 3 weeks of giving the treatment. Both groups showed improvement in pain score, but Group A showed significant results as compared to Group B. This finding is consistent with results obtained from previous studies which state that neural mobilization decreases pain. Neural mobilization, along with conventional treatment, was found to be more effective in managing chronic radicular low back pain, as well as in improving the range of motion than giving conventional treatment alone. To critically appraise this article, the main strength was that this was a randomized control trial. There are a few limitations in this study. The participants were given the treatment for 3 weeks, but they have not mentioned the dosage or duration for shortwave diathermy. And they've also not mentioned how many times the exercises were performed during the 3 week period. Also, both the outcome measures included in the study are self reported, so we cannot say how reliable they are. The second article is Effects of Neural Mobilization on Individuals with Chronic Low Back Pain by Marina Ramos. The objective of this study was to evaluate the effect of neural mobilization technique on individuals with chronic low back pain and also to analyze possible changes in pain and motor behavior before and after treatment. In this study, 16 individuals were included, and a total of 10 sessions of neural mobilization technique was given. The patients were included if they had chronic low back pain, which may or may not radiate to one of the lower limbs. Patients who were aged 18 or older were included, and they had to have a score of more than 4 on the visual analog scale. They were excluded if they were suffering from acute low back pain, spondylolisthesis, fibromyalgia, had previous spinal surgery, cancer, or cognitive disturbances. Before the intervention was given to the participants, a clinical evaluation and assessment of pain intensity, spinal mobility, and hip goniometry were also carried out. And a quality of life questionnaire was also asked to be filled out by the patients. Participants were subjected to two evaluations, one before and one after the therapeutic program. Quality of life was assessed by using the Oswestry Disability Index, Roland Morris Disability Questionnaire, and the World Health Organization Quality of Life Questionnaire. Results obtained from this study suggested that neural mobilization technique, when applied to individuals with chronic low back pain, was able to improve their quality of life. It reduced their pain intensity and also increased their functional mobility. All individuals had significant improvement in pain. An average of 70% reduction in pain was seen after the treatment, as evaluated by the visual analog scale. The results of this study also corroborates with the findings obtained by other studies, which also observed an improvement in range of motion of the affected limb after giving neural mobilization. Results also showed average of 25% increase in lumbar spine mobility, which is a statistically significant improvement, and also improvement in joint angles of the individuals treated with neural mobilization for both flexion and extension was also observed. To critically appraise this article, the strength of this article is that the subjects were assessed by a blinded evaluator, and the participants and evaluators both were asked not to discuss the intervention. Also, the mobilization was performed by the same physical therapist from first to last session. The main limitation of the study is its small sample size, and also, again, the outcome measure included in this study are self-reported. The third article is effect of neural mobilization versus spinal manipulation in patients with radicular chronic low back pain by Walid Salah. The main aim of this study was to investigate effects of neural mobilization and lumbar manipulation technique on chronic low back pain, and also to determine which treatment was more effective. This study included 60 subjects aged between 30 to 50 years suffering from chronic low back pain, along with radiculopathy. The patients were excluded if they had any pathology of hip, knee, or ankle joint, had previous spinal surgery, osteoporosis, or inflammatory disease of spine. This was also a randomized control trial, and participants were divided into two groups. Group A received neural mobilization techniques 3 days per week for 6 weeks, and Group B received lumbar manipulation technique 3 days per week for 6 weeks. Neural mobilization technique included straight leg raising and slump technique, and lumbar manipulation technique included posterior anterior central vertebral pressure, lumbar rotation, and rotation with straight leg raising. Comparison between groups were made for patient-reported pain severity and function. Results showed that both groups showed improvement in pain and functional disabilities, but Group B, which received lumbar manipulation technique, was more effective than neural mobilization technique, and it may be due to the direct influence of lumbar manipulation technique on reduction of nerve root compression than neural mobilization technique. The result obtained from this article does not completely align with the results of the articles previously discussed. The strength of this article was that this was a randomized control trial, and they have explained the treatment protocol for both the groups very well in this article. The main limitation, again, is that the outcome measures included are also self-reported. So, to conclude, we can see from results obtained from these three studies that neural mobilization is effective in treating patients with chronic low back pain with radiating pain. Neural mobilization is successful in reducing pain intensity and increasing lumbar mobility of individuals. We can also see that neural mobilization, when combined with conventional low back pain treatment, shows better results by accelerating the process of recovery and it also accelerated the return to activities of daily life, and it improved the quality of life. Thank you. And I hope you liked our video.